The question of using medications in weight loss comes up all the time. People ask me, is it good to use, is it safe to use, and should I use it? And I think the answer is very simple. When you use medications as part of a diet program, medications are very effective. We have to start thinking of weight loss as a medical condition. If we treat a medical condition, most of the time in our society, we're going to use medications. Most of the time when we use these as a program, so that we're using a diet and then we're using the medications to adhere to that diet. So we're decreasing calories, and we would typically get hungry if we decrease calories in certain ways. When we take the medicines, we're not as hungry and we're much better able to stick to that diet that's less calories.
One of the most common medications we use is Phentermine, and Phentermine is an appetite suppressant that does two things. Number one, it makes you less hungry, so it works on the appetite centers of the brain. Secondly, appetite suppressants like Phentermine raise your metabolism, and people burn about 10% more calories than they would otherwise, so it does actually speed up the rate of weight loss. Another medication that we use is Tenuate or diethylpropion, and that is also a stimulant. It works on the brain to reduce hunger and also does raise metabolism. In some cases, we use medications like Phentermine and topiramate together. And there's a medication called Qsymia that combines those two medications. By adding the topiramate, we tend to get better appetite control than using either drug by itself. We're not sure exactly how topiramate works, but we do know that it does tend to help people with carbohydrate cravings, sugar cravings.
The nice thing about it is it's very well tolerated, and it shows weight loss of somewhere between 10 and 14% when we look at strict weight loss. When we look at the other comorbidities, blood pressure goes down several points, blood sugar goes down, cholesterol gets better, sleep apnea gets better, and it's all been proven in a scientific study that the FDA thought was strong enough that the drug was approved last year.
There are some other medications like Phendimetrazine, and Phendimetrazine is a stronger stimulant medication that we'll sometimes use short term, and it both raises metabolism and suppresses appetite.
There's a new medication that just hit the market called Belviq. Belviq is a serotonin 2C drug. It doesn't mean a lot to a lot of people. Back when we used to have the drug called Fen was two drugs together. Phentermine, which is a drug we still use all the time, and fenfluramine, which was a drug that worked on two areas. It worked on the brain to decrease appetite, but it also worked on the heart. With this new drug, we've made a drug much like the fenfluramine that went off the market. It itself will never come back, but this new drug was designed to be specific to just the brain and not work on the heart at all. So we believe we're recreating an appetite suppressant that was shown to be very effective in the past, but now that will be very heart healthy. By itself has decent results, but maybe when combined with other drugs, potentially Phentermine, if it turns out to be good in combination, will give us a lot of benefit towards weight loss.
Many people come to us and they just want to go on an appetite suppressant hoping that that will be their magic bullet for weight loss. And they're disappointed when you combine an appetite suppressant with the right diet plan, with education and follow-up. That's when you get major results, and it wouldn't be unusual to see people lose 25, 50, or 100 pounds through a combination of appetite suppressants and the right diet and education.